Person on the panel is Dr. Balram Pandit. Dr. Balram is from Saint Giles Hospital, and as we had said that there will be some individuals who will be making presentations, will share with you what's happening on the ground and the statistics and how we can find solutions together. Thank you, Dr. Balram.
Thank you. Thank you for your kind words. And thank you for the opportunity given as well. I understand we have discussed this issue before as well, and we are discussing it again. And it has already been highlighted in the previous panel discussion as well. And we are actually eager to see the actions, things moving forward. And this is also a kind of indicator that we are moving forward in form of, if you look at the sequence of paperwork which is required towards achieving some of the solutions, the paperworks are moving. I'm happy with that. However, I will come to some of the points that is expected from me, and I am also interested in sharing those things. So let's start with some of the figures. Obviously, I won't be delving deep into all of those figures, but broadly I can let you understand that last year, if you look at the previous years, last year we had more than 8,000 visits at Saint Giles, which is far more than what we had in previous years. It was 6,000 something, right? And if you go before then, if you compare the data for last 10 years, then you will find that it's near double. The amount of visitations which is happening to Saint Giles has near doubled. So having said that, let's come to the core issue today, that's the substance abuse. So last year when I was making one presentation and the data I have got here, the figures used to be around, specifically related to substance abuse, 20 to 30 patients per month, where you will diagnose with pure substance abuse or substance related problem. When you count the comorbid substance abuse as comorbidity with other existing psychiatric diagnosis, for example, say depression, schizophrenia or other diagnosis, so then the figures would go around 30 to 40 patients. And these are the average figures that I'm talking about, 30 to 40 patients, per month. Now, when we look at the data that we have got for this year, in January we had 103 patients. I'm talking about inpatients. I'm not talking about the people who come to OPD, get prescription, and then they return. I'm talking about the people who become severely ill, and as a result of which they need admission, so they get admitted. So I'm talking about these figures. So in January we had 103. Surprisingly, in Feb it came to 53, right? So, and if you look at March and April, the figure is from 50 to 100 basically, right? And if you look at the type of substance which are more common, last year, as per last year's data, it was relatively alcohol which was coming at the top. But this year it's cannabis followed by meth, then alcohol. Right? So that's how the pattern is changing, and it has changed relatively fastly, I would say, because in December we had looked at the whole year's data, and the figures that I just said few minutes was from December previous year, and this year it has changed in this way. We'll see what happens to these figures by end of the year. So that's about figure. I'm wondering whether you will come for a second round when it comes to the solution, or you want me to discuss solution right now?
You can give your thoughts on that.
Okay, sure, thank you. So, I'm happy that one of our colleague, a doctor, asked a question in previous session. Right, so, and as being medical professional, he would understand easily compared to anybody else. When I say anybody else, meaning people who do not have access to, say, medical knowledge or the informations at least in comparison to those people. That especially when some problem increases in this way, and in general, you first focus on health promotion and prevention. Preventions are, after all, the best strategies, right? If you really want to have good control over things. So, and of course, when it comes to health promotion, you have to start your taking steps way before the arrival of the drugs, or say the risks, basically, right? So, but having said that, it doesn't mean that promotive activities should not be carried out, or awareness activities related to promotion should not be carried out, because there are still people who might not be exposed to this, right? In the community, if you go to various parts of the country, you will find, right? When it comes to prevention, preventive strategies are for those who knows about drugs, its availability, and they are already at risk as well. So when it comes to risk, there are various factors. Risk is not only about availability of the drug, right? There are certain things in people's life which make them vulnerable as well. I'm happy that in previous session, people, I think one of the panelists mentioned about social capital. So strengthening social capital is really important. When it comes to strengthening social capital, it of course it can start with family, right? And one of the things that I have been talking about is like how to strengthen values in the family. 3G family, I have mentioned some of the other sessions as well. So when I say 3G family, I generally mean about 3-generation family, where you have the elderly, because I work in the area of geriatric psychiatry as well. So I look at problem in an integrative way, right? So you have someone in the family who has a lot of experience, right? So grandparents, parents, and the young children, right? So if the 3 generations are living in a family, and of course there can be pros and cons, that is understandable. I understand that some questions might be coming to your mind. So I'm saying wherever it is possible, we should try to secure that 3-generation family, because it's a beautiful combination. If you look at the grandparents, when they have time, they are retired, they stay at home. They can educate and take care of the children when the children are at home and parents are not at home. It can be just few hours, because of course children are at school as well, right? And then I think as parents, you will be more comfortable in having your children in your parents' hand compared to having your children in a nanny's hand, or someone with whom the child might not be that much attached. Having said that, it is also important to realize here that it also secures that bond, secures that attachment with family, right? So that's one thing that I generally talk about. So 3G homes, and a few things which have been happening, like MH gap training of non-mental health professionals. When I say MH gap training of non-mental health professional, I'm especially concerned about not about the staff who have been trained in the capital or city area. I'm aware that some non-medical professionals have been trained from remote rural areas as well. So basically it also strengthens our capital there, say social capital there in the community basically. And then of course it comes to other things like the churches, the way churches will come together, the way for the same cause, the community will come together, and various resources in the community. That's what I meant, right? So, and then I think we also need to ensure, I'm talking about the promotive and preventive strategies. So we know that these days our children they stick to or keeps going to internet or online resources quite often, right? So how can we make the awareness activities more contextual, more relevant to them, so that they get attracted to the relevant material there. So, and I think currently there are relatively less relevant material when it comes to contextual, like Fijian context. And we have discussed this thing previously in some other forums as well. Now, and it's good that, as I said, that this is also kind of a step forward towards addressing this issue. That's why you see people from multiple ministries involved there. So, and especially when, as I mentioned in the beginning, we need to look at the availability. It wasn't available like this before, right? So, and if you leave it, if somebody is having in that mind that health professionals are there, they can take care of the problems. Certainly not, because your resources in the health sector are limited compared to the volume of cases, the number of cases that will be shooting, and the cases are shooting already. You remember the pandemic, right? In mental health, the kind of problems and the range of problems, and if you look at the figures, people are already talking about mental health problem as silent pandemic. It's just that it doesn't kill those many people in the kind of time in which COVID killed people. So everyone panicked and tried to take action, whatever they could have taken in their respective countries. So we can't be basically leaving all these. We can't afford to leave all these things on health sector. That's why we are all together. You see representatives of multiple ministry coming together, and I'm thankful to Ministry of Home Affairs that they have involved us, not today only, but I think we have been part of the previous sessions as well, and the work has, you can call that it's moving a bit slowly, but it has moved forward, right? So, and today again, it's kind of whole of government approach, and people from different departments of ministry is coming together. Right. So I was talking also about the strengthening family values. One thing that I must highlight is, the quarrelsome environment at home, separation, divorce, and death of parent in early age can make the attachment of children unsecured, right? Which can make them develop, as a result of which they can become, they can develop avoidant behavior, right? They can develop anxious traits, or towards they can develop disorganized traits, which can further result into additional mental health, personality disorders and mental health problems. That will certainly, that void that creates, that gets created by behavior of the adult, that is primarily not behavior of the children. So managing adult is equally important, especially in today's world, where you will see in the family it's not the kids who keep on going to online thing, is the parents as well. And unfortunately many times you will find that they live in the same home, but they do not have time for each other. All of them are busy, So the reason why I highlighted this is it's equally important to manage adult behavior. It's equally important to protect family. We are not unaware of breaking family in our society. It's not just values. You see the result, the next thing, the breaking families as well. And when the family is broken, obviously, as I said, the attachment, the secured attachment base gets broken, and they become more vulnerable.
Thank you very much, Dr.
So, there are so many other things.
we will also make sure that we will have that discussion during the Q&A as well, and Charlie and his team will get all the details based on your proposed preventative measures. We have discussed, Mark Evans, the CEO of NRUA, had raised the issue about social capital, a lot of discussion, and Dr. Balram has mentioned that as well. We discussed about the younger generation and what needs to be done. The 2019 Laudala document and again 2020 Laudala document stressed a lot about having more counselors in schools. We were in dire need of counselors, and also questions were being raised in relation to the awareness campaigns. We stopped hearing about the HIV/AIDS awareness campaigns. Maybe it was because of budgetary issues for the past few years. and reach and frequency did not come through there in making sure education takes place. The other issue is about discipline, children's discipline, and what more can be done. How can it be looked at as far as the curriculum is concerned? So Camille Evans is from UNESCO's